I'm at the offices of the Dermatology Laser and Vein Specialist of the Carolinas, where you will find total rejuvenation in their newly remodeled 12,000 square foot center. Dr. Munavali has performed rejuvenation procedures on political figures, on professional athletes, and on actors in his career in California, in Maryland, and now in the Tar Heel State. So let's go inside. I want you all to meet Dr. Munavali, who is very special to me. For whatever reason that women get varicose veins, I had them. They were painful, they were embarrassing, and this is the doctor who helped me with the problem. Dr. Gilly, thank you very much.
Thank you, Barbara.
You know, I went to 4 doctors, and you were the first one that diagnosed the problem. Tell everybody about that.
You'd been to several doctors, and it was pretty obvious to me that they had not researched the underlying issue. When I looked at your legs, it was more so looking past the spider veins that we all have into what was really causing you to have aching and throbbing, and that was what we referred to as saphenous reflux. And once we identified that problem and diagnosed it in the office, we were able to use a brand new technique called the CTEV endovenous closure to go in there and really non-invasively seal it up, and I thought your legs got better within several weeks.
It worked wonderfully. No more embarrassment and no more pain and no more discomfort. You actually developed the CTEV, am I right?
Yeah, I was really fortunate to work with some of the leading minds in lasers and phlebology and really expand that procedure to what it is today. It really is a remarkably non-invasive procedure, and I think the success rates we were getting in the trials were upwards of 95% after 2 years, so it was really a successful technique.
The Gosselin Center has been a respected center for years in Charlotte. Tell me what's been added now that you're here.
Gosh, well, in addition to housing all the devices and our wonderful staff, we have an area set aside exclusively for research, an institute, if you will, because we do a lot of educational as well as scientific research that really helps us to define better what our patients need. That space is dedicated. We have a clinical trials coordinator, and we get involved in nationwide trials to really try to determine what the best treatments are.
Dr. Munavali, I grew up in the Carolina sun, and we just did not know any better. We went out without sunblock, and therefore I had a lot of sun damage. Tell everyone what you did that really was amazing.
Yes, that is called photoaging, and it's just a consequence of the sun and exposure to ultraviolet light. So the different visible light sources that we have, we're able to use, direct them towards the skin in a safe way using cooling, and that light is absorbed by the red and the brown specifically, and those will just peel right away within the course of a couple of days.
And that was almost instant gratification, and that fascinated me too. There was no downtime. I came over, I had a treatment, I went back to work.
Well, in addition to removing red and brown spots, we can also use lasers to remove fine lines and wrinkles, and we do that very selectively. We heat up the skin underneath, and that causes collagen to reform, and it really can reverse some of those aging changes that we have. And again, that's also a consequence of the sun.
A lot of people are concerned about the tattoos that they now no longer want the world to see. Is it possible to get rid of those?
Yes, tattoos have been around since the dawn of time, and they're really a social mores in the sense that you can't show them at work. If you want to have them, you have to keep them hidden. Problem is that people have gotten them over the years, and they can't hide them on places like their wrists and their ankles and so forth. It's become a huge treatment option. We need to use really specific lasers to remove the specific colors in a tattoo. For example, red, blue, and black each require different lasers to remove, and so it's not very easy to find a tattoo center that can effectively remove those, and we can effectively treat tattoos. Usually within 6 to 10 treatments can get a really nice resolution.
For whatever reason, whatever our age, we seem to be fascinated with the pores of our skin.
Yeah.
Why is that?
Pore size is one of those things we see every day in the mirror when we look, and there's a lot of genetic reasons why we have the pores we do, but it seems to connote a sense of cleanliness and health, healthy appearance to the skin. And so the cleaner we can keep our pores, I think our skin tends to look healthier. There's different technologies nowadays that can assist us in this, and different technologies that can help us to evaluate how this is improving. And one of the technologies we use is called the isolase, and the isolase uses vacuum and light to basically cleanse the pores, and you can actually see that after each treatment by mechanically pulling the pores open and extracting out the oils from our skin. Consequently, the pore size shrinks a little bit, and the skin just looks so much more radiant. And we can use VISI analysis and different analysis tools to show that afterwards.
Another problem that people of all ages seem to have is acne. Are there any new techniques, any new technology for helping that problem?
Yeah, acne is a tough one. We have it as adolescents, but we also get it as young adults and women into the 30s and 40s. Still get it, and it's just can be very psychologically, emotionally disturbing for patients to go out and interact with the public with this. So acne has been around for forever, and dermatologists see so much acne. So what's new in acne, aside from the medications, is the ability to use devices, both lasers and light sources, to treat acne effectively and much more rapidly than you can see with a medication. So nowadays we're talking about just a matter of weeks to get clear skin from acne. Because most medications take months. These new devices can do it within weeks. Patients were much more happy, and their self-esteem is much increased after these treatments.
And the devices, I'm sure, are much safer than the medication.
That's right. I think in combination, they both form an effective pair. But some of the worst acne that I've seen, some of the most nodulous cystic type that can cause scarring, even that can be reversed with a series of treatments with these devices.
I've heard a lot about Perlane. I'm fascinated by that. What is that?
Well, Perlane is the newest in the family of dermal fillers from a company called Medicis, and you may have heard of Restylane. Restylane been around for several years now. Perlane is kind of the bigger brother, if you would. It's a thicker substance. It's a dermal filler, something that already exists in the dermis of our skin that they've been able to purify in a very safe way. We inject that back into the skin, and that absorbs a lot of water from the surrounding skin and fills in all the folds and wrinkles and things that we have on our skin, and inside our skin, which are a consequence of volume loss. And Perlane is excellent at restoring the volume to a more healthy state.
Don't be shy. Save us some time from doing all the research and share with the audience now some of your credentials.
Yeah, well, first and foremost, I'm proud to say I'm a board-certified dermatologist, and that carries on a proud tradition from a really fine field of medicine. As dermatologists, we've branched out and been able to subspecialize in different procedures, such as the Mohs procedure we do here, and that Dr. Gosselin's been doing for 20 years, endovenous procedures, which we did on you, in addition to a lot of cosmetic procedures, which required some advanced fellowship training, and I did that all across the country. At Mayo Clinic, University of California, San Francisco, Emory University, then most recently back at Johns Hopkins. And so I'm very fortunate to bring all that experience back home to the Carolinas.
And I'm sure that Dr. Gosselin is so pleased to have you as a part of his work now and to see it continue.
Yeah, he's just a wonderful person, and I'm just as pleased to be here with him. I think both of us work very well together to bring top quality skincare to the city.
In addition to your amazing credentials and all of your training, I understand that you actually teach around the world.
I do. As one of the results of being on the cutting edge, we're able to share our techniques with people all around the world, and I learn something from them every time I go.
Well, we thank you very much for coming to Charlotte and sharing all this expertise. We are very fortunate to have someone with the credentials, with the skill, with the talent that Dr. Munibali has. And if you would like your own complimentary consultation, you can give them a call at 704-375-6766. Thank you so much.
Thank you.
Dr. Gilly says skin cancer is the most common form of cancer in the United States. More than 1 million cases are diagnosed annually, and more than 90% of all skin cancers are caused by exposure to the sun. Occasional use of tanning beds almost triples the chances of developing skin cancer.